The next slide is courtesy of Professor Mauseri and Stefano Colli in Milan, Italy. It's a patient with Takayasu's disease. And notice that the inflamed arterial wall is tremendously vascular after the contrast injection. By the way, all these contrast injections are injected through a peripheral vein in the arm, circulating through the right heart, lungs, ultimately to the left heart, and then to the carotid artery. So none of these are arterial injections, but venous injections requiring only a ½ milliliter of a contrast agent. In this slide, you can note that the inflammatory wall is filled with vasculature consistent with the inflammatory nature of Takayasu's disease, and in fact looks very similar to the previous images I've shown you with atherosclerosis. And in fact, the next slide, courtesy of Hans-Peter Westcott from Hanover, Germany, what you will notice is that the plaque can be seen intruding upon the lumen, but you can also notice there's an external surface to the plaque, which is positive remodeling as well as negative remodeling, and in fact, the atherosclerotic plaque is filled with contrast agent, signifying that the vessels are within this tumor or atherosclerotic plaque. The next image is a patient of mine who's a 53-year-old diabetic gentleman, not on a statin. On the left, in real time, you can see the common carotid artery. You can see the contrast entering. And if you will note, at the bifurcation, there's an exceedingly bright signal which indicates the vasoazorum over the bifurcation. The image on the right is 8 months later after placing the patient on a statin to reduce the inflammatory response of atherosclerosis to the arterial wall. As you note, when we approach the bifurcation on the right, the vessel that was so apparent on the left is now only a remnant. This is probably the first indication of regression of angiogenesis seen in a patient. This was published in 2006. This patient example was 1 week ago in our laboratory. It's an asymptomatic patient seen for preventive screening. As you will notice on the posterior far wall, the IMT can be seen as normal. However, as we approach the bulb, there's IMT thickness, and if you look carefully, in fact, in one of the plaques seen at the bulb on the far wall, there's actually vasculature. As we move towards the bulb in the same patient, you can note that the far wall plaque identified at the bulb is in fact quite vascular as well as thickened. And the final image in this sequence shows that the plaque not only intrudes into the lumen and is vascular, but also extends outward or caused positive remodeling. So the tumor or plaque actually extends both inward and outward and is readily seen in this example. Now, what about quantification of these images? To date, most efforts have been simply qualitative. Working with Dan Adam from Haifa at the Technion Institute in Israel, Dan has developed an in vitro test model where we can actually design the carotid artery and the vasoazorum. The next series of slides will show our results. What you see on the left slide is flow through the plastic tubing in the lumen, and if you notice in the upper left, you'll see the small vessels flowing through the vasoazorum. In a series of calibration studies, we noted that as the contrast concentration increased, so did the video image in both the lumen and the vasoazorum. As we began to develop this model, we are now using 3D imaging of the vasoazorum and lumen. When we move into clinical studies, we have also performed calibration studies. What you see in this slide is an intravenous injection of 0.5, 1.0, and 1.5 milliliters of an ultrasound contrast agent. In the patient, the lumen is increasingly bright, and the vasovasorum, as identified by the green and blue regions of interest, are also increasing in brightness. And if you look at the graph, you will notice that as the lumen increases in brightness, so does the vasovasorum, very similar to the in vitro tube study. Furthermore, we are looking at ways to quantify the vasovasorum. We have identified a region of interest between the lumen and the intima media, and that considered a standard vasovasorum baseline or normalization. And then we have a region between the green line, as you see, and the blue line, which includes the vasovasorum. So in order to do this, we actually developed a ratio of adventitial intensity to lumen intensity. Based on this data, we have looked retrospectively at around 159 patients from our laboratory. What we found is that patients who had significant more angiogenesis had, in fact, an increased incidence of heart attack or stroke. Now, this represents a retrospective study correlating the presence and amount of angiogenesis in our patients. It does not represent a prospective study at this time. Furthermore, we are looking to develop animal models that mimic the human atherosclerotic condition. We've been working with researchers at the University of Wisconsin involving the vasovasorum activities seen in the Rapaz familial hypercholesterolemic swine model. What you see in the upper right corner is an insert of the FH swine, and in the lower left two boxes, the femoral arteries and the histology of the femoral artery. On the right, an angiographic view, and below that, the ultrasonic view of the femoral artery. What you will see now on the right is a real-time image of a contrast injection, intravenous injection in the FH swine. The lumen is highlighted, but what you'll notice above the lumen are presence of angiogenic vessels filling the wall, indicating atherosclerosis. Simply seen in this slide, we then began to develop a serial quantification of the vasovasorum in the FH swine. At 5 weeks, 13 weeks, and 43 weeks, please note the vasovasorum above the lumen was poorly seen at 5 weeks, minimally at 13, and was significantly seen at 43 weeks. In our conclusions, then, the contrast-enhanced imaging is a unique platform to study atherosclerosis, and the Rapaz pig model apparently is a good place to begin this investigation. Future issues will resolve the difficulties we currently have in planar imaging with 2D, and what we prefer to image is a volumetric analysis of the carotid artery, the lumen, and the vasovasorum as seen in this slide. Ultimately, the 3D representation as shown here will show the lumen, the bifurcation, and the adventitial structures in one volumetric analysis. Finally, site-specific drug delivery therapeutic systems are being developed. The microspheres carry agents, and with the activation of ultrasound will deliver at certain locations their payloads. A simple slide demonstrates the agent is mixed with the microbubble, and the ultrasound energy then destroys the microbubbles and delivers the agent at sites. Thank you very much.